I really want to emphasize that, because one of the other things about the type of funding Rotary provides, and I've been fortunate in having a couple of grants in my career from Rotary itself, is that they understand that ideas have to be allowed to flourish and develop. And so they support good ideas, but they also support good people and teams. And they then allow the clinicians or researchers to devise the study, and they don't interfere with it. You know, a lot of research at the moment is very driven by some economic goal or some other outcome. And that puts real constraints on parameters that actually are likely to stifle that research. And sometimes as you're doing research, as I said, our findings surprised us. So we were able to adapt to that. You know, we were able to build on that. And that's really important in research. I mean, that engages researchers, and we then stick closely to the path of discovery. Otherwise, people can do all sorts of research, but does it ultimately change lives? Does it impact in terms of providing new knowledge? Does it discover new things? I would argue no. So I think Rotary has a very good model, and very, very grateful for their ongoing support.
Australian Rotary Health have been an incredible source of support for both me and my colleagues working in mental health, particularly early career researchers. So as you mentioned, both my doctoral and postdoctoral research has been supported by Australian Rotary Health. And I think that they're really ahead of the game, both in the way that they have chosen to focus on mental health, but also to support early career researchers, because it is really difficult to obtain funding in general for mental health, but particularly for early career researchers and starting your own program of research and being given that first opportunity. So for me, that's what Australian Rotary Health have given me, as an opportunity to start my career and to build my own program of research, which wouldn't have happened if I hadn't received the scholarship or the fellowship.
And if it wasn't for your funding, we wouldn't have even started developing programs for young children, preschool age children and like early primary school. So you helped us start a snowball of positive effects and positive ripples through the community. That was the beginning, but it didn't stop. It kept growing and growing and growing. And now, as a result of your funding, we've helped thousands of families and their children develop positive coping skills and be brave and be stronger and be calm and more empathic.